My name is Stephanie Rodrigues. I am a PhD student, member of the SEI Brazil team, and I'm going to present some of our reflections about the production of data by SEI team in the communities participating in the ECLIPSE project. To begin with, we would like to introduce the four communities we are working with: Orobó, Corte de Pedra, Alto Alegre, and São Paulinho. These communities have Afro-Brazilian and indigenous ancestry, are in the rural area of the Recôncavo da Bahia, have great natural resources with biodiversity in the presence of rivers and sea. They also have high levels of social inequalities, poverty, lack to access to public policies on education, health, transportation, basic sanitation, among others. This is Orobó. This is Corte de Pedra. This is Alto Alegre. This is São Paulinho. The SEI Brazil team works together with the ethnography and arts teams, and among our main activities are virtual and face-to-face meetings with the community consultative groups, GAC, of each communities. The GAC is made up of participants from the communities and the ECLIPSE team. Among the participants from the communities, there are community leaders, representatives of organization, and the political management of municipalities, educators, health professionals, domestic workers, retired people, among others. Many of the GAC members are childhood friends, family members, neighbors. They work together. That is, they are people who already had bonds before the arrival of the ECLIPSE project. Along with the GAC meetings, the SEI Brazil team's practices include thematic meetings with specific objectives, such as a meeting with health professionals from a certain community health team, formal meetings with health and environmental policy managers, home visits following the work of community health agents, participation in artistic activities proposed by the art group, informal meetings not scheduled along with the ethnography work. These activities have taken place virtually in times of aggravation of the pandemic situation and in person on trips to communities. We realized that data production is possible in the virtual platform. However, the quality of data production and bonding with communities happen much more effectively in person. Our actions are in the theory based on the colonial principles such as good living, popular education, and Ubuntu. The good living is a philosophy of life from the Amazonian indigenous people, which brings reflection on harmony with nature, care, reciprocity, and solidarity between individuals and communities. Popular education is a pedagogical proposal coined by Paulo Freire that brings in its conception the value of others' knowledge as a process of collective construction, education as an instrument of awareness, liberation, and transformation. Ubuntu is an ontological principle from African philosophy with an emphasis on the cultivation of values such as collaboration, respect, tolerance, empathy, unity, among others. I am because we are is a sentence that summarizes the political practice of Ubuntu and that we seek to apply to our work as researchers at each meetings with the communities. Our actions have made us realize that there is a diversity of perceptions and experience of community members in relation to CL and the health disease care process. Most people have already experienced the disease or had a family member who did. We learned about the relationship with the reference center in Seattle. We learned about the action of community health agents who often, without technical training, need to act as volunteer injector to medication necessary for treatments. We learned about children and teenagers who needed to take care of sick family members. We listened to stories about the origin of the disease, its relationships with the environment, with the territory, and the absence of public care policies. We learned about how communities use natural traditional knowledge to take care of themselves. Anyway, the stories about Ciel are countless and we would need a specific meeting just to share all of them with you. The Say Brazil team identified basic and structural demands that communities need to assist in the care of treatment of CL, some of which are basic sanitation, garbage collection and treatment, environmental and agricultural policies on land use, means of public transportation that would allow rural communities to have access to a specialized healthcare network, training of health professionals to treat the disease, activation and dialogue between primary healthcare teams, hospital care, and specialized care in CL. We consider that these demands are social inequalities in health, which create vulnerabilities in communities. These inequalities are the result of the historical construction, a colonial and non-democratic political project in Brazil, a political project that is based on racism and economic inequality based on the vulnerable situation in which they find themselves, it is possible to notice that some people in the communities see in the ECLIPSE project an opportunity to have their structural demands met, and then they have created expectations in relation to the project's performance. As the Say Brazil team, we understand that is part of our goals to dialogue with political managers and public policies. However, we also understand that our role cannot be welfarist and paternalistic since the construction of empowerment is based on the political awareness and the organization of the members of the communities fighting for their rights. This is us. I am because we are. Thank you.